Good afternoon, Glenn Kinniski. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
You can now start your OET roleplay.
Hello, Mihiraa. My name is Glenn, and I'm one of the registered nurses looking after you today. I can see you look a bit worried and that it's taking a bit more effort to breathe at the moment. That must feel very frightening. I'm here to help you through this and to talk about your care. To start, could you tell me in your own words what brought you into the hospital today?
Hello, Glenn. Thank you. I just couldn't cope at home anymore. Over the last few days, my breathing has gotten so much worse. I felt like I was constantly gasping for air, even when I was just sitting in my chair. I got so scared, and my family insisted on bringing me in.
I'm so glad you listened to them and came in. That was absolutely the right thing to do. Mihiraa, to help me understand exactly what you're going through, could you describe your symptoms for me in a bit more detail? For instance, tell me more about the breathlessness and the cough.
The breathlessness is the worst part. It's there all the time now, not just when I walk around. And my cough has become much more frequent and persistent. It's very tiring. I'm bringing up quite a bit of phlegm, which is yellowish, and I feel completely drained of all my energy, even after a full night's sleep.
Thank you for explaining that so clearly, Mihiraa. It sounds like it has been an exhausting and difficult time for you. Now, to help you with that breathlessness, we are going to start you on some oxygen therapy, which is a key part of your treatment. The oxygen is delivered through these soft prongs in your nose to directly support your breathing. Its primary role is to ensure your body receives the essential amount of oxygen it requires for your vital organs to function properly, especially when your lungs are struggling. This is a very safe and closely monitored treatment. However, it is absolutely crucial that you do not adjust the flow rate yourself. The specific rate has been carefully prescribed by the doctor based on your current blood gas levels and medical needs. Changing it independently poses a significant safety risk, as too little oxygen won't adequately relieve your breathlessness, while too much oxygen can be dangerous for some COPD patients, potentially slowing your breathing down too much. Your safety is our priority, so we will manage the settings for you.
I see. So, I just need to leave it exactly as it is?
That's exactly right, Mihiraa. Just leave it as it is set. Now, alongside the oxygen, your inhalers are another vital part of managing your COPD, as they deliver medicine directly to your lungs where it's needed most. To ensure you get the full benefit, let's talk about the correct technique. It's important to begin by shaking the device well to mix the medication properly. Then, as you start to breathe in a slow, steady, and deep breath through your mouth, you press the canister to release the medicine. This controlled inhalation is crucial because it allows the medication to travel past your windpipe and deep into the smaller airways of your lungs. Once you have taken a full breath in, try to hold it for a few seconds, around 5 to 10 if you can, as this gives the medicine time to settle onto the lung surfaces. Mastering this technique is key because it ensures the medication can work effectively to improve your breathing by actively reducing the inflammation and swelling in your airways. By consistently keeping this inflammation under control, you can significantly reduce the frequency and severity of your symptoms, which in turn helps to prevent future flare-ups and hospital visits. What are your thoughts on that process? Do you have any specific questions or concerns about using your inhaler or perhaps the oxygen therapy we discussed?
I think I understand. I've always worried that I'm not using my inhaler right. Sometimes it feels like it just hits the back of my throat. And with all of this, I just feel so anxious about the future. Is this going to keep happening?
That's a very common worry, Mihiraa, and it's completely understandable to feel that way. I want to reassure you that while COPD is a long-term condition, it can be managed very effectively with the right plan, allowing you to live a full and active life. We will work closely with you to create a personalized management plan that is tailored to your specific needs. A cornerstone of this plan involves embracing key lifestyle adjustments. If you are still smoking, quitting is undeniably the single most powerful step you can take to protect your remaining lung health and slow the progression of the disease. To support your body's overall strength, maintaining a healthy, balanced diet is essential as it provides the necessary energy to fuel your breathing muscles and fight off infections. Furthermore, integrating daily breathing exercises such as pursed lip breathing will train your body to control breathlessness by strengthening your respiratory muscles and improving the efficiency of each breath. Alongside these proactive measures, It is equally vital that you can recognize when to seek immediate medical attention. This includes a sudden or significant worsening of your usual symptoms, such as increased breathlessness, cough, or a change in your sputum, and particularly if you are using a home oximeter and notice a consistent drop in your oxygen saturation levels below your prescribed target. Knowing these signs ensures we can act quickly to prevent a minor issue from becoming a major flare-up.
That makes me feel a bit more hopeful. My doctor once mentioned something about a special exercise program, but I never followed up.
I'm glad you mentioned that. The program you're thinking of is called Pulmonary Rehabilitation, and it's an excellent suggestion. It is a specialist program designed for people with lung conditions like yours. It involves supervised exercise and education, which work together to improve your stamina and muscle strength, leading to better day-to-day symptom control. People who complete the program often find they have fewer hospital visits because they feel stronger and more confident managing their health at home. It's a very supportive environment. Would you be happy for me to refer you to the pulmonary rehabilitation team so they can come and talk to you about it?
Yes, please. If it can help me feel stronger and stay out of hospital, I'd really like to try it. Thank you for explaining everything so patiently.
It's my pleasure, Mihiraa. You've taken a very positive step today. I'll get that referral started for you. For now, just try to rest, and remember, I or one of my colleagues are always here if you need anything. Just press the call button.